My name is Mike Hayton, upper limb surgeon from Wrightington Hospital in England. I'm going to show you how I do a tennis elbow release, including decortification of the lateral epicondyle under local anaesthetic. Preoperatively, I think it's important to mark out the skin incision about 3 centimeters over the lateral epicondyle with a skin marker, because once the local anaesthetic has been infiltrated, the bony landmarks are difficult to feel. I use adrenaline to reduce the need for a tourniquet. The local anaesthetic is injected subdermally and it's blown up to the size of probably a golf ball. Once the dermis has been anaesthetized, it's then possible to anesthetize the deep fascia and really below the deep fascia against the periosteum to allow the lateral epicondyle to be decorticated with bone nibblers, again all under local anaesthetic without a tourniquet, without any problems. I usually allow this to work for 10 to 15 minutes, which is usually the time the patient comes into the operating room to be prepped and draped. As you can see, it's just a careful process of just anaesthetizing all that subfascial area. A 2 to 3 centimeter incision is made over the lateral epicondyle that you've previously marked out. It's just blunt dissection now down through the fat, down onto the area of the lateral epicondyle. Once you're through the fatty areas, the lateral epicondyle is really quite easy to feel. And once you've identified the lateral epicondyle, it's then released of its overlying fascia, and then very carefully the lateral epicondyle is denuded of its common extensor origin with sharp dissection. And really I expose both the anterior and also the posterior aspect of the common extensor origin and the lateral epicondyle to an area probably about the size of a little fingernail. I don't actually mark it out in surgery, but I've done this just to demonstrate it. And then with bone nibblers or rongeurs, the lateral epicondyle is decorticated down to bleeding cancellous bone, and then it's take care just to make sure there's no sharp edges having performed this, just with the tip of your finger, just to check that it's nice and smooth, and then obtain hemostasis. But this is rarely needed if adrenaline is used. I like to close that fascial layer just to reduce the risk of a post-operative seroma, and then a subcuticular stitch and steri-strips over the top. Post-operatively, I get these patients moving straight away. Within 2 days, their bulky dressings reduced down, early range of movement actively, and really most patients have recovered from the main effects of the surgery within 4 to 6 weeks. And that's really how I do lateral tennis elbow release under local anaesthetic. Thanks for listening.